All right, this is going to be an example of how to use the ICP for a new patient coming in for a short visit. So first, open ICP, go to your desktop and open up Google Chrome, and then open up Next Tech. I'm using the sandbox, so put in your username and password. Go ahead and log in, submit. All right, so this is a sandbox, so it doesn't have anything on here. But if you're actually in a live environment, you'll see something like this, where over here, this is the list of all the patients, depending the providers that's selected. And what the front desk going to do once the patient is checked in, they're going to move the patient into the waiting room number 1, where at that point, your technician is going to take that patient and move into their individual rooms. And once that technician is finished, he or she will move that to waiting room, the dilating room, or will send it directly into your exam room. So each time the movement is done, the chart needs to be refreshed, or else the patient is not going to move. So please remember to refresh when you do that. So because this is a sandbox environment, I'm just gonna search for a name. I'll use, all right. So this is a new patient. You shouldn't have anything on here. Just ignore some of these things because I played with it in the past. So it should be blank here because it's a brand new patient. You're gonna go, this is what we call a summary page, where, a general chart summary. And this is the encountered summary of, the last visit and all that stuff. And we'll go into that a little bit later. You go ahead and select Pro in the upper right corner to open up the chart. So we're gonna create a new chart. So there's a new patient. I'm just gonna go down, select my name, profile, comprehensive. Actually, I'm gonna do glaucoma, but it should be the same. Location, I'm just gonna do myself for now. And I'll just use a blank encounter as a default. But if you want to default to the previous encounter, you can select these. But for now, I'm just going to use a blank encounter. Then we'll save. Once it opens up, reason for visit, there's a new patient. Go ahead under history of present illness. So I want a second one. The first chief complaint. All right. So chief complaint for this patient today, I'll say pain. We go to location. Just say the right sharp pain. Modifying factors. How about artificial tears do not help? Associated symptoms. We just need 4, but you can do more. Tearing and severity. I'd say severe. And what else? Since I'm also going to add on in here, patient was working in the yard. Don't forget to also have to check mental status exam, being normal. Specialty meds, just say lisinopril. Click on systemic medications review. Next, past surgical review system. We'll start with past medical history. So let's lisinopril for high blood pressure, hypertension. Next, go to surgical history. I'll say non-contributory. Allergies. We'll make it simple. None. Family history. Non-contributory. Social history. We're just going to click on defaults, as though it will generate negative for smoking, alcohol, and substance abuse. Review system, which is put on default since the patient is hypertensive. Go to cardiovascular. Now just go down to blood pressure stable. Next, visual acuity, 2060 without correction, maybe missing 2 letters. In the right eye and the left eye, patient has good vision, 2025. So next, pressure, it's going to defer, dilation, refraction. No, we're not going to do any of those. So I can close that. So I just go, that's done. I can go over here and say that's done. Done all of those. Systemic meds, I guess I did something here. Thought I put lisinopril already. Click on the side. So that's done. I did all of this. Actually, I'm going to go back and change this. Specialty meds is it's more like ocular meds. I wish we can change that so it doesn't get confused. So none there at this time. So next we go to the exam for external. So let's see here, in general, pupils, motility, confrontational adnexa. If you did evaluate, you can just click on default right there. But if you didn't, you can delete it. Motility check, confrontational, I didn't check. Adnexa, guess that's just based on appearance. So next, that's the external. Anterior segment, same thing. We're just going to go click on right here. It's going to pull the default setting. So lids and conjunctiva, of course, that's not going to be normal. There it is now. Look for injection. There it is. Injection chemosis. What? Get rid of this. Chemosis. Diffuse. Severity. Maybe 1 plus. I also want to do injection. I'm going to add another line. Injection is also diffuse. Severity, maybe 2 plus. So next, I'll look at the cornea. I'll look for it's a scratch, abrasion. So I'm going to click on that. This abrasion is located centrally. Since this is, I want to, when the next time I come back to review this chart, I want to see this. I'm going to highlight it so it shows that. And I'm also, what I'm going to do is I'm going to add it to my plan. See, it says cornea abrasion, so I don't have to repeat this. So cornea abrasion, or you can pick one of these. I just put cornea abrasion. It's in the right eye, and this is an initial encounter. Once that's selected, and you can add the item, what that's going to do, it's going to bring it down to the impression and plan so you don't have to do it again. Next, in terms of gonio, posterior segment, I did not do any of those. So in this section, we're missing the procedure part of it. So they're working on that. For some reason, this comprehensive profile is missing that. So I'm just going to go to a glaucoma file for now, profile for now, to pull up the procedures. So you see that? So now we see the procedures. So the next, we're not going to do any diagnostics. For the procedures, what we're going to do with this patient, we're going to do a bandage contact lens. Bandage contact lens. And it'll generate some treatment risk and benefit of the procedure. I'm just going to delete that. Impression and plan. Let's do default. So when you click on that, it'll say, we said, okay, we'll bandage contact lens placed. We are going to start antibiotic drop. Next, I'm going to ask him to reverse this order. All right, next we're going to send a prescription. So we said we're going to send Ocuflox. So that. But when we select on the medication, it's going to generate the manufacturer recommended dosing. We just have to select the eye. Then after that, we should be able to put into prescribe here. Since this is a sandbox, it won't link that. It's a pretty the same e-prescribing a module that we've been using with the SRS. We can also add tiers, artificial tiers. We're going to use just in the right eye, 4 times today in the right eye. So next we're going to do a follow-up with me and 2 days. It's going to be a short exam. All right, next, we're not going to send a letter. We're going to go straight to, so impression plan's done, procedure is done, exam is done. Go ahead to go to coding. So we just ignore that because it's just a fake patient, there's no appointment. All right, so these two are repeated, so I'm just going to delete one. All right, select the exam, new patient. Select the diagnosis. Okay, so next one, select the diagnosis, and then we're done. So you have the exam code, procedure code attached to the diagnosis. And once you're done, just go right here and sign. And then save and close. All right, so once you're done with the patient, just say that the same patient was seen a few days ago for that cornea abrasion, and now he or she is back a few days later for a follow-up. When you pull up the patient summary page, you can see here there's a chart summary. You can go in and kind of select the date of the exam that you want to view or review. This one was the date that was recently entered. You have a little image in here. I guess that didn't input right with the cornea abrasion. But here it tells you the information, just the general information about, the patient's vision, the medication that was, that was when the patient left the clinic. And here in terms of the follow-up procedure that was done. And then so you can have an idea of what to do next for the patient. All right, so in some instances, like my example here, I forgot to do one thing. So if you need to go back and make some changes to the chart, just go ahead and go find that patient. Open up the chart here. Go into Pro. The last exam will populate. All you do is go to Unsign. This one I wanted to show you how to do a drawing. So this is anterior segment. So you can select cornea, or you can choose whatever part you want to draw. So this is a cornea abrasion. So I'm going to bring it in a paintbrush. So this is a drawing that I did previously. I'm trying to get rid of that. But I'm going to show you. So we select on cornea. We're going to do a cornea abrasion. So these are the colors you get to pick. So I'm going to pick green. And this is the brush size. You can change the size however you want. Then I'm going to draw my abrasion. So remember, this panel is drawing for just the right eye. And this panel over the left, over here, is drawing for the left eye. So since we're only working with the right eye, we're just going to stay with this. So once the drawing is done and you're happy, you just go ahead and save that. So you can view the image whenever you need to. Or another way to look to see all your images, go back to your patient summary page and just go down, go up to images, and you should be able to see the previous drawings or any of the other testing that was done. And after that's done, you just need to sign it again and then close.